welcome everybody. This promises to be quite an exciting panel discussion event tonight. So we're joined by 4 guests tonight. So we're joined by Awais, Trish O'Hara, Martin John, and Sarah Joseph. These are our cherished guests tonight for this panel discussion event on long COVID. So I hope you're kind of all just as excited as I am for this talk. We'll also pop into the chat box the full calendar for BACSI events on the BACSI website. And this also goes into your e-news every Friday. So we've got lots of events that we're looking forward to this month. The cherry on our cake is our Wednesday, the 16th of December event for a case study discussion. So this is sort of our call to action. We're inviting any members who have had experience of treating long COVID, successful or not so successful. Any stories you have, things that went particularly well, things you learned from treatments, anything you want to share with the membership. We're sort of really hoping to be hearing from you on Wednesday, the 16th of December, and I'll pop Fiona Lamb's email address into the chat box as well for you to get in touch. But without further ado, I will introduce our very esteemed panel for this evening and hand over to Sarah Joseph straight away. So we're joined by Awais, who will be a very familiar face for anybody who studied at London South Bank University as the biomedical lead on both the undergraduate and the postgraduate acupuncture courses there. He's also the vice chairman of the Wuxi Tai Chi and Qigong Association. Trish O'Hara, joining us from Belfast in Northern Ireland, has had experience treating a high number of long COVID cases and is the founder of the Wellness Scribe. Sarah Joseph, our panel host for the evening, is a 5-element acupuncturist of long esteem and regional group coordinator for London Southwest and Central London. And last but not least, Martin John, who has been a council member of the Register of Chinese Herbal Medicine for the past 8 years, and has a special focus in his practice on treating digestive issues, gut dysbiosis, the microbiome, and in later years has been lecturing more and more on this area. So without further ado, I'm going to hand over to Sarah to take over, and really look forward to hearing from all we have to say on this topic. Over to you, Sarah.
Hi, good evening, everyone. It's really lovely to see so many of you here. I am an acupuncturist. Before COVID, I didn't really see people presenting with flu or external pathogens. And so the insight that our panel have given into this is absolutely amazing, working at the coalface. So I'm going to hand over to Awais to start with. Thank you.
Hi, everybody. Can everyone hear me okay? Fantastic. Firstly, big thank you to Alan, Fiona and Sarah for putting on the event, and for everyone back at head office doing the hard work as usual at the British Acupuncture Council. And a big thank you for my fellow colleagues, Martin, who's joined us from the Jade Screen Project, Trish, who's coming from all the way from Belfast and has been really busy with COVID cases. And we're going to hopefully try and give you an insight into some of the experience we've had over the summer, and to give you a way of kind of feel your way into the inevitable, probably reality that we're all going to face, which is we're all going to be treating a little bit of long COVID over the next 12 months or so. This morning, I think I had a rough estimate that there are over 300,000 predicted cases of long COVID to be expected pre-Christmas. That's quite a phenomenal figure, really, in terms of post-viral or kind of post-viral syndromes. And it's quite likely that in certain hotspot areas, whether you be in the Midlands or London, north of England, that you are going to see some patients who may have a plethora of different symptoms. And hopefully today will give you an indication of where to start. And the other thing I'd like to just quickly say is previous talk sounds amazing. I haven't had a chance to watch it yet, but the idea that immunity is a fluid thing in Chinese medicine and not an arbitrary thing that comes through an injection, so important to the way that we can understand how to help and work with people. So taking some time just to go back over that talk and just to revise what immunity mean to us as acupuncturists, whether it be a combination in nutrition, constitution, pre, post heaven chi, for example, and what does that actually mean when it comes to looking at patients? Because that's fundamental to our treatment strategies of how to help people recover ultimately. So what do we have to work with post-COVID? So initially in our 2 regional meetings, we started with a brief chat on what is COVID. There's a lot of various information out there, a lot of misinformation, a lot of contradictory information, and not contradictory by trying to catch you out. It's just because the nature of dealing with a new virus and the delay in research being published means that you're going to get one study that says one thing, and you're going to get another study which inevitably says, well, hold on, I'm seeing this. And it takes time to disseminate which is the more consistent pattern that you're seeing with patients, and ultimately then feed that back into primary care. And it takes quite a bit of time. So to give you an indication, the World Health Organization is looking at or critiquing about 1,000 articles on COVID a day from all over the world. In terms of joint collaboration, there's more joint collaboration through universities, hospitals, and research partners than there's ever been in the past. So the modern world, the internet, has really helped bring experts together from all over the world to hopefully develop better strategies for dealing with COVID and non-COVID. So I'm going to start by opening up the slides. So hopefully you can all follow us through. If anyone has any trouble seeing the slides, just please raise it in the chat box and one of my colleagues will pick that up. There we go. Okay, so we're going to start by just a very brief overview, and then we're going to actually look at probably the most interesting and weird case I've come across so far. I figured if we're going to share a case, we might as well share the one that really challenged me in every sense, really. And I'm quite happy to raise my hands up and say, yeah, this was really tricky. And I had to really think hard about which way I'm going to come and treat this individual. And I'll explain why as the slides go on. You know, the vast majority of patients may present with particular categories of symptoms, which again, we'll talk more about when we get into the long-COVID section. But this one was a little bit unique, a little bit strange, so challenged me in different ways. So as we move on, we're going to look at the Western view on COVID in general. Unfortunately, we know that in the last week, the UK has passed well over 50,000 deaths. And I think when I checked yesterday, it was 52,000. And I've got to say, I can't look at the counter thing because it's just depressing. So I didn't bother to go back and update the figures from today. But essentially, it's been unfortunately prolific in affecting vulnerable people. And what do we know about COVID so far? We know that it is ultimately a respiratory virus and a respiratory illness. I've heard few experts and people in biomedicine and osteopaths call it a vascular illness. And what they mean by that is that it has an uncanny ability to spread through the capillaries into the surrounding organ structure. And that might be facilitated by the ACE enzyme because it really uses the ACE enzyme to latch onto to find a pathway from the exterior into the interior of the body. So ultimately, how does COVID actually lead to death? It does this by leading you down the road to something called acute respiratory distress syndrome, which is not uncommon. It could happen to you after a stroke. It could happen to you if you've got chronic COPD. It just basically means that your body lung function completely gives up and cardiac function completely gives up. This usually happens by basically extracellular fluid from inflammation from the initial process of infection, clogging the capillaries or the pulmonary capillaries, which means that no oxygen can permeate and cross into the alveoli and the bronchi, which then ultimately leads to increased heart rate and blood pressure to try and get more oxygen into the system. And when that doesn't happen, you know, the same as a stroke or a heart attack, where there's no oxygen, where there's no chi and blood, cells die. So the lung tissue starts to die and necrose. And then ultimately that leads to areas of scar tissue developing in the lungs, and eventually leads to a complete loss of function, and then eventually catastrophic failure of the respiratory system. And the other thing where we have been thankful to learn is that we know that COVID-19 specifically attacks and joins onto the protein structure of the ACE2 enzyme. So you remember from university, we talk about lock and key mechanisms. Well, COVID needs a mechanism to get from the upper respiratory tract into the interior, to cross the gate or the throat and get into the chest. And the way it does that is it binds to the receptor site on the ACE2 enzyme. And the ACE2 enzyme, as we know, is most abundantly found in the lungs. It's produced by the renin-angiotensin system in the kidneys. So you can think about lung-kidney relationship a little bit if you like, okay? And some of you may be familiar with the term ACE inhibitor, which is a class of drug which is used to affect your blood pressure. So all of us will have patients who are taking ACE inhibitors, okay? So the same enzyme is responsible for allowing the COVID virus to attach and go inwards. So it binds to the protein and ultimately leads to a lack of oxygenation and a loss of function. And what's really interesting is we also know that the ACE2 enzyme is found in the liver, the lungs, the heart, and the intestines. And in TCM, these are all kind of what is called smooth muscle areas, and these tend to be abundant in Wei Qi in some schools of thought. If you look at the evidence coming from certain long COVID cases, then actually we've seen evidence of quite systemic lung damage, but we've also seen heart damage, myocarditis or pericarditis, or damage or inflammation around the heart tissue. We've seen renal failure, gastrointestinal inflammation, inflammatory bowel symptoms in long COVID patients. And we've seen changes in brain function recorded by CT scans. The advice from China was that CT scans should be done pretty much for every patient. But unfortunately, with the pressure on the system, we've not really been able to do that. But what's been amazing in the reports and the research coming even from Korea in the early days, in Korea, they had one person flying from Wuhan with a fever, and they isolated her. And within 4 days, they tested her and produced a test kit and decided to start the process of producing mass testing and various other things. But when they CT scanned this lady and they did some bloods and they tested her sputum as Western medicine does, they do full bloods, they test the sputum or phlegm coming up for any bacteria. She was asymptomatic at this stage, this particular woman. She had no symptoms other than a mild fever, and that came later. But when they CT scanned her lung, it's like she had bronchopneumonia. It was systemically damaged already at this stage. So all already we knew that we were dealing with something which is highly unusual. We normally see that kind of damage in patients with lung cancer or severe chronic COPD. You don't see it with somebody who doesn't even have a cough. So already the alarm bells were ringing. What is this virus about? Why is it acting in a rather strange way? And what do we know about this family of viruses? You know, there's been a lot of coronavirus has been thrown around a lot. And yes, it is part of the cold family. You remember that Western medicine relates structure to function. So the structure of the virus ultimately predicts how it's going to behave. So if we understand the structure of the virus, we can try and predict its pattern of behavior. So in December, our Chinese colleagues actually managed to sort out the genome sequencing. And by the 3rd January, it was disseminated across the world. Presumably there was a bit of a Christmas break, and then eventually it made it across. And then since then, we've been able to kind of compare strains and kind of feed back into potentially producing vaccines or medicines that may inhibit the virus structure and inhibit it from working. In an ideal world, if we could block the ACE enzyme, we could block the root of the virus in. Okay, if we could change the structure of the virus, we would stop it from fitting into that key, lock and key mechanism. So lots of different ideas coming in the early days. But the one thing we found out very quickly is that there are approximately 7 coronavirus types which affect humans. There are many in the animal kingdom as well. So coughs and colds that can affect our cats, dogs, horses, you name it. And we also know that SARS-2 is very similar to SARS-1, which we saw a few years back. Approximately 96% similar in terms of its viral genome. And Middle Eastern respiratory syndrome, which is MERS, which was less talked about in the West, because it didn't really affect people in the West. It was really something which affected people in Asia and the Middle East, is actually incredibly similar. But what we know about the virus is that MERS has a worse mortality rate, but it's less infectious. So if you're in a tube carriage with somebody with MERS, you're less likely to get it compared to COVID-19. But if you get it, you're less likely to survive. So make of that what you will. Similar, cousins, essentially, they're cousins. So I'll let you come back through some of these slides in the future. The basic idea is that we know without any shadow of a doubt that the mechanism of spread is both droplet and aerosol spread. So thinking about keeping your clinic clean, ventilation, open windows, having a good protocols, good mask policies are very important with an airborne pathogen. And there's some notes for you guys here to peruse in your own time. So it talks about how many droplets are expelled when you breathe, sneeze, or talk. And then why it's so important to potentially, if you've got a busy clinic, to do some consultations over the phone to reduce your viral load, if possible. Now, at the end of the day, we've got to do physical exams. We need to put our hands on our patients. We want to try and limit how much we need to do that if you have a busy clinic. And the other thing to just take a note of before we move on into what is long COVID is that we know a couple of basic things. We know that the vast majority of infection is largely asymptomatic. According to which paper you look at, it's anywhere between 40% to 70%. But effectively, almost half of all transmissions that we've been able to track successfully have come from asymptomatic patients. That is really unusual. You know, we were brought up to think that if you have a cough, a cold, and a fever, you're contagious. If you don't have any of that, you can go high five, go swimming with that person, go for a beer, and it's not a problem. You can be contagious up to 5 days before you show symptoms. And the virus has had incubation periods recorded in Wuhan of up to 21 days. So although the most likelihood is 7 to 14 days to show symptoms, it can be literally up to 21 days was the longest recorded period. Then we had a little bit of chat about cytokine storms, which is all in the notes for you, and the fact that your body's response to this virus is quite peculiar. It seems to overreact, and it seems to basically behave in a way which creates a whole bunch of confusion from your immune system and stops it from working in an efficient way to actually provide a defense to this pathogen. And that is a little bit unusual as well. So a little bit of notes for you to look at there. And then if we look at what is long COVID, or I mean, it makes sense to me. I call it chronic COVID off the top of my head because, but the term that is fashioned or being pushed forward is long COVID. And essentially what it means is it's got a long tail. And what that means, and when they say long tail in Western medicine, it means that the symptoms tail off really slowly, okay, long period of time. And effectively, the definition according to the National Institute of Clinical Excellence is any symptom that goes beyond 3 weeks from the initial onset. So anything that goes on from 3 weeks onwards could be classed as long COVID. It is largely, the diagnosis is largely done as a clinical diagnosis, okay, because most of the patients we will see, or the GPs will see, will have had COVID so long ago, their anti-level bodies would have dropped and they're unlikely to test positive. And because if you had it in March and April, there were no tests available, so no one was tested. So we're really doing it from a clinical perspective. We're looking at what happened to them, what were their symptoms at the time, how have they felt since then, and is this something else? And if it's not, do they then come into this category? So this information comes directly from the CDC and National Institute of Clinical Excellence, so the two kind of leading bodies in the National Institute of Health in America. And then I took a little bit from research journals which showed a wider scope, if you like, of symptoms. So I tried to draw in a collection of resources for you. So we know that you can have a variety of different symptoms. It's not just cough, fever, and loss of smell. Many patients that I'm treated with long COVID had very mild symptoms. Some didn't even have a cough. Some had more pronounced symptoms. And the severity of your symptoms doesn't seem to be a predominant factor in the severity of your long COVID symptoms. So whether you have mild symptoms doesn't mean that you have mild or long COVID symptoms. If you were ventilated or incubated, you tend to have different problems due to the mechanical aspects of ventilation and the trauma caused by that. However, there are people who, most of my patients were much younger than I would have predicted, which was slightly scary. I thought long COVID patients would come in between 45 to 65, and actually they were 30 to 60, a lot of my patients, and young and healthy, and never really had to slow down for anything. So what are the common symptoms for long COVID? It's largely, predominantly, shortness, like somebody who's been asthmatic and suffering with maybe an acute infection. Chest pain, headaches, neurocognitive difficulties, potentially some neurological symptoms like tingling in the extremities, muscle pain and weakness, a bit like somebody with fibromyalgia. Or you can have symptoms a bit like rheumatoid arthritis, random joint pain. So the pain can be in the joints, or it can be in the muscles, or it can be in the sinews. It could be in any of those places. We have to work that out. You could have gastrointestinal symptoms, metabolic problems, and also recently, I came across a study which said that 60% of long COVID patients are experiencing a huge amount of depression and psychosis. And that's also intermingled with the fact that lockdown is really hard. And we've been in lockdown for quite a while in a lot of areas. So it's all mixed together. But effectively, maybe the damp, the phlegm, the lack of yang qi is all having an effect on how people's shen is being obstructed in Chinese medicine. There's a couple of other symptoms for you to have a look at in the list. It's all available for you. But I think the best way to get a better understanding is to actually look at a case. So I'm going to have a swig of tea and then let's crack on with the case. And I've also put in a slide for you of some of the kind of, I think CDC and NICE and the World Health Organization will go with the most common long COVID symptoms. But that's not going to help you with that one rare case which presents with that awkward long COVID symptom which isn't on the list. So with the case studies and various things available to us through scientific literature, I've tried to give you a more interesting list on the next slide, including mentioning this idea of sticky blood, turbidity due to toxicity in the blood, which some people have talked about stroke, COVID-related stroke, for example. And other people mention things like COVID-related psychosis as well. But we'll talk about that a little bit later. So we're going to talk, eventually, we may have time to come back and look at different theories. One of the important theories is simply to go back and look at how viral pathogens interact with Wei Qi, how they get into your body, and when your body encounters an incredible pathogen, is it able to combat that pathogen? You know, we have this idea that the Wei Qi gets into a battle with the pathogenic factor. It eventually pushes its way inside. You know, the burglar jumps over the garden fence, comes through the kitchen, starts to steal your food out your fridge, but has he taken your telly yet? Okay. So you can use any analogy that you like. You must have a framework for understanding the pathogenesis of the pathogen to formulate your treatment around and your understanding around how has this virus affected this individual's energy ultimately. And one of the things to take note of is that with COVID, we are in the area where it's quite likely to have pathogenic factors or retain pathogens, and also quite likely for there to be some aspects of latency or pathogens that may be lying dormant, which then become cyclical. So what happens when pathogens are overpowering the body's system, producing a huge amount of toxic heat, which is destroying qi blood and damaging the cells, the body tries to push that pathogen into an area where it can store it and manage it and create some time. It's buying some time. And in doing that, it's trying to stop the organ systems from collapsing, or the Zhang Fu and the primary meridians. Now, in traditional acupuncture, we talk about, and this comes back to really old Qigong theory, which is really even older than old acupuncture theory, where they talk about pathogens living in the folds or creases of the body. And they meant the joints and the lymph nodes in the olden days. Then as acupuncture theory developed, they started to understand the relationship between the deep pathways of the primary meridians and the divergent channels and the sinew channels and so on and so forth. So sinew channels, as you know, are rich in Wei Qi. Divergent channels act as a reservoir, like extra meridians. When the body needs extra resources, we can call up the reinforcements, the territorial army. And also what they can do is they can contain that pathogenic factor and allow them to live in the joints until you have enough qi and blood to potentially either expel that pathogen, either through your bowels, through sweating it out, or coughing it out, or pushing it out through the pores, however it may be appropriate. So always come back to fundamental theory. One of the best exponents of this is thankfully Anne Cecil Stearman. Her book is amazing on the topic. And there are also many other amazing teachers on this topic too. And I would encourage you all to go and listen to their webinars and talks. They're fantastic, simply. So if we come on to the simple idea that before we go into long COVID, we have to respect that there is no treatment in Western medicine, guys, for either COVID or long COVID, okay? It doesn't exist. Regardless of any political anything, the simple data says that there is no clear-cut data which shows that this is a path that we need to take for COVID or long COVID. There's lots of trials going on, whether it be monoclonal antibodies, hydroxychloroquine, this Regeneron, which has been in the news a lot. Okay, these are all in trial phases. None of them have yet been approved for actual use with COVID because they have mixed reviews so far. And in due time, we'll know more. So there's lots of slides on what resources doctors have to treat people. You know about steroids, and you all know steroids manage inflammation. So dexamethasone, you've all heard about in the news. So there's a little bit about that to help you get your head around it. But ultimately, there is no actual protocol for treatment of COVID. It's about managing the inflammatory response, making sure it doesn't damage or put you into a coma, and then dealing with the symptoms as they arise. And exactly like in long COVID, Western medicine tends to do graded exercise, which is supposed to be supervised. Because if you tell someone in their 30s to go and do exercise, they go to an Ashtanga or a Bikram yoga class, when what the doctor meant was go for a walk. So often they get carried away because they think they're recovering, and the energy takes a massive another hit because they have a crisis at work or an emotional crisis or a physical overexertion and the nervous system gets frazzled again. Okay. So for muscular pains and aches, it's anti-inflammatories. For psychological aspects, it's CBT and antidepressants. And then they refer you to a long COVID clinic. And I recommend you all go and see our links, and you follow the Royal Medicine link and listen to all these professors be really open and honest and say, we haven't got a clue, guys. There's a brand new video that came out, which I'll try and put into the chat later whilst one of my colleagues is talking, which shows someone having a go at trying to get a better sense of the pathogenesis of this pathogen in Western medicine. But effectively, they're saying we don't know how to help long COVID patients. And what this patient I'm going to share with you today was actually referred to me by the UCLH long COVID clinic, because it was such a weird case that they looked up what if they had anything similar reported in China. And this case study that they saw in China was treated by acupuncture and herbs. So rather than do anything really invasive, they said, why don't you try and find an acupuncturist whilst we put you through all the tests? And thankfully, she came to us and has had a quite lengthy course of treatment since then. So our colleagues, a bit like with chronic fatigue, a bit like with post-viral syndromes, it's an area where they do struggle. And it is a complex area for many reasons, and primarily because of this idea of retained pathogens and pathogens moving in and out of latency, if you like, okay? They don't consider, we don't have the same framework as they do, so we come at it in a different way. So there's lots of notes for you to flick through at your own leisure, okay? There's some dietary advice, some advice about Qigong, advice on a few supplements which might be helpful, all stuff that you probably come across, but hopefully you can see it all in one place. I tried to put links to some of the sources. I didn't put them all in, otherwise there'll be references and links everywhere. And next, I'd like to share this case with you, if that's okay. So from here, we've got a young lady who's 37 years old. She's professional. She's quite young, I'd say. She's the sort of person who'd do a boxercise class, a yoga's for hippies. She does something more aggressive, and she's very successful in her career, very driven, so on and so forth. And she initially contracted COVID in April. She had extreme fatigue, shortness of breath without exertion, which for somebody who's 37 is very unusual. She could not stand. She was dizzy. She had leg pain. And interestingly, she had tachycardia. So tachycardia is an increased heart rate, so fast heart rate. So she was in bed for a total of 4 weeks initially, completely flat. On the 5th week, she tried to get up and just go for a walk. And I think it was a brisk walk. And she said that completely wiped her out and she couldn't move for another week. and she was back in bed. So after approximately 8 weeks, she was able to return to work part-time, but at this rate, her peak heart rate was still over 120 beats per minute. By June, she had pretty much had a complete, what she described as a mental and physical collapse, and had to give up her flat and moved in with her mum, who thankfully was an ex-nurse and was able to take her in and just kind of give her a bit of space so she could heal and not focus on doing other things, because things she couldn't cook for herself. And in the middle of lockdown, it wasn't easy for someone to bring her food. So that was another source of stress and worry and anxiety, which is going to deplete her further. So we suggested, before she was booked in, when we were talking via email, I suggested that she potentially find a buddy to help her out. And thankfully it was her mother. She had little appetite, and she said she had little joy for anything in her life. She felt completely wrung out. Previously, she was successful, very social, and interestingly, having looked at the fact that her heart rate was so high and that there was something wrong with her nervous system, is what the neurologist told her, she started to look at meditation, which, by her admission, she said, you couldn't pay me to do that stuff before. But she was a really good sport, and she decided she's going to try. Now, she ended up in hospital several times because her heart rate went so high that she thought she was going to have a heart attack or something like that. So she needed to go and have echo scans and ECGs. She would often present with palpitations initially, and they really were very good. I mean, they checked everything with her. They gave her 24-hour monitors, 3-day monitors, echograms. They checked her for myocarditis. Because they realized she'd had COVID, they checked her blood clot markers. They were slightly raised, but not significantly raised. So they put her on a monitoring program to check if she had this sticky blood and whether she was going to have a pulmonary embolism, which is incredibly dangerous. She was sent off to neurology because the cardiology department felt that it was a neurological issue why her heart was going nuts. And cardiology would send her back to neurology. Neurology would send her back to cardiology because they were saying, well, we can't see initially anything wrong, so we're going to book her in for some longer tests. And she was also referred to the long COVID clinic. So since then, she was also told to join a Facebook long COVID forum, which was, she said, the most useful piece of advice when she got to the specialist long COVID clinic. So basically they hadn't got any advice for her. They just told her to join Facebook and talk to other people with COVID, find out what helped them, which is useful to some extent, but also very confusing because there's such a mixture of presentations. The advice is massively different. So her Western diagnosis was sinus tachycardia with no obvious cause. Initially, when I first met her, autonomic dysfunction was suspected, and she was referred for more autonomic testing. So in essence, what's gone wrong? Is it the brain is sending dodgy signals to the heart, or is it that the heart is not listening to the signals coming from the brain? Where between the two has this gone awry, is what the neurologist is saying. So in order to do that, in order to find out, we need to do some specific testing. Now, she suffered with some migraines in the past, but they became more frequent post-COVID. And this is also very common in other long COVID patients. A lot of head symptoms, whether it be tinnitus, dizziness, earaches, sinus problems, even in people who didn't have a history of these. And she was also prescribed nortriptyline initially for her migraines before coming ill, but came off everything during her illness. When I saw her first in August, her oxygen levels were stable and quite high, which was reassuring. Her resting heart rate in my clinic was 115. Tongue was pale, slightly swollen with scallops, and a little bit redness on the sides, really. And her pulses were contradictory, to say the least. The lung position was deep and weak. I think because she'd walked, or she probably walked calmly, but it felt like she'd run a marathon to get to me. And I specifically asked her lots of questions before we got into the pulse to allow it time to settle. But it was still rapid and forceful at the top, but empty at the bottom, and a bit contradictory, really. So objective of the first session really was to calm her, harmonize the nervous system, and to reduce a little bit of fatigue. That was her objectives, really. She was very, she's like, this is what I want. If I said to her, we're going to tonify your spleen, she would have said, see you later. She was very clear. She said, this is what I want. The experts have told me that I need to calm my nervous system. I've heard acupuncture is brilliant for this. This is what I want. And until I had a better sense of what was happening to this lady, I thought actually just to bring her energy to a place where we can work with it was actually a really good place to start. So with a lot of people with chronic fatigue and post-viral syndromes, I'd often look to raise the energy level up to a point where we can move chi without effectively scattering their chi. So I'd look at tonifying lung, spleen, and kidney, moving a bit of liver chi. Any signs of damp or phlegm need to be dealt with, any signs of heat. So initially, again, you'd expect this lady to have a bright red tongue, and it just wasn't there. She had a pulse of raging full heat, but there was no obvious heat sign. There was no constipation, there was no dry skin, no dry hair, anything like that. Really, no big thirst. So again, slightly contradictory. This patient also had white coat syndrome. So she'd get a bit anxious about having her BP taken and it would shoot up. So the best thing for her to do was to have a cuff on or a Fitbit, which was discreet, and it just constantly read her BPM throughout the day. Every time you go and try and take a pulse, it would shoot up for 5 minutes. So the treatment principles really were, in terms of TCM, was to calm the Shen, reduce heat, regulate heart and liver qi, and support her Zheng qi or overall qi. In the first session, and the way I saw it was a bit like dropping somebody's blood pressure who had really high blood pressure. If you do it too fast, it's actually going to make them feel rather ill. So we decided to go gently, but it was still a relatively strong treatment because this poor lady had such strong symptoms. So we did pericardium 6, classical theory, first treatment, I didn't want to use the heart meridian. I wanted to come in through the pericardium. Large intestine 11, Ren 17. I used 2 tongue points on the heart channel and the thigh, Tongshen and Guan, 8801 to 8802. You can use any of them. I chose to use the 2 bottom ones. Yin Tang, she had tried to read everything on the internet about chronic fatigue in the space of a month. Just needed to calm her down a bit. Middle 4 horses, which is phenomenal. It's lung and kidney orientated, but it's in the stomach channel. It's a water point. It's just a phenomenal point, and is used a lot in autoimmune conditions, used a lot in chronic fatigue in Tung's acupuncture school. And rather than use a lung and a kidney point, I wanted to use just one. So I chose to use the middle 4 horses in particular. And if there was any autoimmune attack on her heart, I wanted to try and cover that as well, was my thinking. Often with these type of patients, I would have cupped as well. So I would have cupped the DTO1, DTO2 to stimulate lymphatic movement, to try and clear the toxins left over from the inflammation. If somebody's full of toxins, you can't build their energy up. You've got to clear their energy a little bit first and make room to build something. Okay, it's a bit like spring cleaning. You can't buy new furniture till you throw out the old stuff. So, but it didn't feel appropriate for this particular lady. I'd normally consider doing a bleeding treatment, but again, I just felt that was all too strong. And I think she was also fairly skeptical, open but skeptical about acupuncture. So I wanted to start gently. So we started on weekly sessions. Over the course of the first few weeks, after the first treatment, she said she felt calm, but she said she felt very weird. It's like her body didn't know her nervous system was kind of ebbing and flowing between full-on cortisol adrenal responses to trying to relax a bit, and then it would snap back a bit, and then it would relax a bit. And this made me think, okay, well, she'll get more used to the stimulation as her treatment goes on, but we've got to go gently. So as each week went on, we added a few selection of points. I'll give you a bit of breakdown briefly. So we added stomach 43. So in Tung's acupuncture, we use the stomach channel to relieve a lot of excess of the heart, okay? So stomach 43, stomach 44, yin spring point, fantastic relieving heat from the chest. Then I added in a point which was used to regulate heart problems, Xin Chang. So famously used on the Vietnamese president by Master Tung after a stroke, 1 needle to correct his paralysis. But it's also good for rhythm and rate or heart problems. We used Mu or wood anger on the left. We used a little bit of ear acupuncture because then it has a slightly different effect, different connection to the cranial nerves and getting into the cardiovascular center of the brain. We did some back shoe treatments, really classical acupuncture, like classic TCM. So gallbladder 20 for the migraines, 13, 15, 17, 18, 23 to just raise the key organs. reduce headaches and fatigue. If you kind of take the neurological view, back shu points work on the parasympathetics, particularly the lower lumbar and sacral ones. And also doing a back treatment enabled me to get a bit of cups on for the first time. So I had an ulterior motive, is that I wanted to stimulate her wei qi by doing some cupping. After about a month, she went back to cardiology and she had another long cuff on for several days. And it showed that her BPM had dropped to 109. Not a lot. There were periods where it dropped more, but the average was 109. It showed a regular sinus tachycardia with arrhythmia, so one little flutter in 24 hours. Her blood clotting levels, the D-dimer level had dropped from 800 to 600, which is great. It means that we're clearing some of the toxicity from the body. And her energy had risen to 6 out of 10 from 4 out of 10, but it was still very fragile. Then eventually I added, for those of you who do scalp acupuncture, I added the prefrontal points. So prefrontal points are fantastic at calming the whole nervous system. It's the acupuncture Valium. You know, it has an incredible ability to just drop the level of brain activity and neurological activity incredibly quickly. And this poor woman had been in full cortisol response for months on end. She must have been exhausted in that respect. So I really wanted to do something, not just to drop everything down. Now she was getting more used to the treatment. And also then the nature of neurology and how the brain talks to the heart and so on. So I'll leave it for you to read in the slides. You can see I added in also Ho Chan and Ling, which is an alternative to pericardium 6 and 7. It was just because of the position of the hands, I could get to it easier. It works on the chest through the Sanjiao meridian. Liver 2 instead of liver 3. Okay. And then recently, she's been back for further testing. And they have basically done all kinds of tests to her nervous system, tilted her this way, played her videos of all kinds of things to see what happens to her heart rate and whether it drops back down. Thankfully, they saw that her sympathetic and parasympathetic system is working, because initially they thought her parasympathetics just wasn't working at all. After now about 2 months of treatment, there was some response from the parasympathetics. If this test was done 2 months earlier, we would have a reference point, but we didn't, unfortunately. And eventually, through all of the testing over the last few months, her final diagnosis from her cardiology and neurologist is something called inappropriate sinus tachycardia. And this is effectively an abnormality in the sino-atrial node, which leads to a high resting heart rate. And it has no cause in Western medicine, as there's various hypotheses, but nobody really knows. The treatment generally is to put you on beta blockers to suppress the heart rate. And as somebody who's never really taken a lot of medication, she was quite resistant to this. And I've talked to her a little bit about saying, look, you know, we need to give your nervous system a break. Whilst we're building up your cumulative effect of your acupuncture, maybe we should try just a 10 milligram dose, just so that you can be calmer and we can get your energy into a better place. And then we can wean you off eventually. And we'll see what she's considering it at the moment. Over the last month or two, her Fitbit now shows her BPM is now 85 to 95, but can still shoot up above 100 if something happens. And her energy levels are much better. She still has some migraines, so I added in bleeding the ear apex to clear the whole head, really. The brain fog actually went quite early in the treatments, but her migraines remained. We also put her on lion's mane mushrooms quite early on, because there was a risk that there was some neurological damage to the heart tissue. And I was a bit worried, because I thought, you know, acupuncture is going to be great at stimulating those nerves and stimulating some neurological healing in that area, but there's nothing like lion's mane when it comes to healing degenerated nerves. She's moving in the right direction. It's slow but steady work. Compared to a lot of my other long COVID patients, she's been by far the most complex and the one that I've had to give the most consideration and build up really gently. And she is improving. And there were other patients I had, just to give you a point of reference, where they had fatigue, and in 5 treatments, they're doing so much better. I only need to see them once a month. I still need to see this lady every week or weekly or fortnightly if possible. And we're working a lot with meditation. Now she's starting herbs as well. She's never taken anything like herbs or mushrooms before. So didn't want to overwhelm her. So slowly, as she got more trusting, I introduced the idea of potentially having herbs to lift her energy on a daily basis and to calm her system, really. So I put a few alternatives for the tongue points for anyone who doesn't do tongues acupuncture, because it doesn't matter what type of acupuncture you do, guys, whether you do Japanese, whether you do Korean, whether you do classical, TCM, Beijing, Shanghai, Nanjing, it's all great stuff, and you can all help people. And this I thought was the most interesting case. All of my notes from the previous
thanks so much for such an interesting case. That's really fantastic, and thank you so much for choosing such a complex one to really show the breadth of what acupuncture can do. That's really fantastic. Can we perhaps come back to this and see if we've got some questions in the end? At the end, if you do have some questions for Awais, please do put them in the chat, and we'll come back to them.
For having me here tonight. You have to excuse me, I've got a bit of a cough and I'm trying not to panic myself, but here we go. I just want to quickly show you a little booklet that we've created for you. So it's just going over some of the TCM phases. This little area here is something that we've created. So it's basically what we've seen in clinic. It's not set in stone or anything. This is just giving you an example of what we've seen. Also, we've all added in some wonderful tips. So hopefully you will find loads of information here to help you on your journey of long COVID. I'm just going to take you right to the bottom here. And also we've got a list of resources that we've used quite frequently. Okay. So again, I'm going to keep this very brief for you. This was just a little case that I had. It was a very difficult and challenging one. It was one of my first cases in actually long COVID. So it was in early March and a patient had just finished getting his 2 little kids ready for bed. And he suddenly got this really bizarre, like burning sensation in his middle finger. And it would have been around the area pericardium 9. So earlier that day, he did notice a loss of smell and taste, but at the time he didn't connect it to COVID-19 because it was still quite early in days of what we knew was symptoms at that time. So the next morning, due to severe vertigo, the patient fell out of bed. So this would basically be day 2. Let me put this up bigger for you. So sorry. There we go. Is that better? Okay, so in day 2, these symptoms followed. His wife was terribly worried. They called 111 and were told to self-isolate and treat at home. So the following morning, husband's still quite bad. The wife calls the GP, who then prescribes antibiotics just to cover a chest infection, just in case. So this patient never received a test nor needed any hospital care. And these immediate symptoms kind of resolve within about 4 to 5 weeks. But then these all came a lot more transparent. So this is, oh, sorry. So this is what I seen when he first came in to me. He was extremely pale and gaunt. So I actually know this man because I actually treat his sister, I treat his dad, I treat the whole family. So I know him quite well. And I noticed that he had lost so much weight. I just couldn't believe it, how gaunt and thin he looked. On visual palpation of the abdomen, there was a red flat rash on the upper abdomen, and also his stomach was still quite bloated. So this is 4 months post-COVID at the time. He had a large swelling on the left side of the neck, which was just basically a swollen gland. He had leg and arm tremors during treatment, which was super interesting because even though the patient was awake on the table, he was very zoned out, but his legs and his arms were just going crazy. And I remember looking at him going, how can you not be aware of this? You can't be aware of what your body is doing right now. But he just was clueless. So there was just no communication happening from head to body. And you've got your swollen glands and just no movement happening whatsoever. Also, he described a nerve pain in both arms this time. So it went from just being left arm or down to the finger to both arms, going from gallbladder 21 area. And it was predominantly around the pericardium Sanjiao channels. Another really interesting thing was it was sunny yeah, definitely sunny when he came to see me the first time. And he said that he couldn't even stand outside in the sun because he felt like it was burning his skin. But he generally felt really cold, which I wasn't surprised he'd lost so much weight. Previous medical history, this guy took really good care of his health. He had low back pain, came and went. He also had a knee operation in 2017, a little bit of IBS, but he said he had that well under control for years. He had a lot of diet change and, you know, started really taking care of himself, working out quite a lot. So 3 weeks prior to the first acupuncture appointment with me for long COVID, he did come up with some abnormal blood tests, predominantly the kidneys, and also the thyroid was out, a little bit hyper, and also he had an arrhythmia. So the arrhythmias are quite common in Western medicine when there's any like severe systemic inflammatory conditions. So this is like a common thing that can happen when you've had a major pathogen that's entered the body. So I was really hoping that this would calm down for him. The other thing is, which I was really disturbed about, was this. So 5 months post-infection, like his symptoms were truly awful. He was really on it, like he was doing loads of research and his family were all medical. So they were all advising him. And finally he went and got this MRI done, which I'm really glad of, because just coming back to this leg and arm tremors during treatment, sometimes, just sometimes, like it's really normal for people to move around the acupuncture table, but not to this degree at all. And sometimes that can be indicative of brain inflammation. So it was just really interesting. And I've had 2 people in like that. So this was not an isolated case. So that was another really interesting thing. Let's see. Okay. Insulin and tachycardia. So his sister had ME, the dad had coronary artery disease. He was on gabapentin for nerve pain, multivitamins, isotonic drinks, and the GP removed the sleeping tablets eventually because, you know, it was 4 months, which is to be expected. So in a 24-hour period, the patient usually got 2 to 4 hours sleep. Patient can fall asleep but will not stay asleep. He naps at every opportunity, day or night, and it's roughly around 30 minutes a nap. And he sweats at night. So he's got extreme fatigue, low energy, and also brain fog. His diet, he's following a low histamine diet. Again, he's really involved in his own treatment plan, which is excellent for me. So we really went at this one together, which was a lovely experience. Digestion wise, he had quite loose stools, bloated abdomen, again, the significant weight loss, and still no appetite. So his taste and his smell return, but they're just not quite the same. And I'm not quite sure if it's, you know how if you can't taste or smell anything, you just have no appetite anyway. And also he's got quite a lot of spleen and stomach issues going on in the background. The urine is cloudy, which actually can be indicative of like a heart pathology in TCM2. So that's something to keep in mind. And his mood, he was feeling quite depressed and anxious, which is really understandable. So this was a picture of his tongue. They're in quite good light. It was done outside. A little bit of blood stasis with cheese stagnation heat. Definitely a heart spleen pathology, spleen cheese sinking. You've got your damp cold and a little bit of yellow in the center. But that wasn't too significant, but it was definitely there, that yellow staining. So the tip of the tongue, quite interesting, looks like an inverted heart. So that's possibly body fluid essence deficiency or blood deficiency or heat in the heart in itself. The pulse was very deep and very weak, and it was actually really hard for me to find. I struggled with it. I thought, you know, where is it? And he was even laughing, going, "Can you feel anything?" I'm like, "Yes, of course I can, it's all there." And I also was really surprised because of the symptoms that he didn't have a more fast pulse, more full pulse, but it was so deep and so weak. Okay. So the diagnosis, of course, you've got your Zheng Qi deficiency. You know, so it's like we definitely have to do a lot of support in there. You've got your damp cold invading spleen and stomach. You've got your damp cold B syndrome affecting the arms, PC and TH. You've got your fluid deficiency and stagnation. You've got qi stagnation with heat and phlegm, qi and blood deficiency and stagnation, yin shu, underlying heart, spleen, and kidney shu. So I felt like there was a lot going on. This could also be classed as a Shang Yang pattern with masses and amounts of stagnation representing the lingering pathogen, half Yang and Yin stage. And some might even see it as affecting the Xiao Yin or Jie Yin levels because it's gone so deep that it's actually caused this brain inflammation. You've got the tremors and lots of hot and cold symptoms. So there's so many different ways and so many different angles that you can look at it. So don't be worrying and just keep it as simple as you can. So the treatment aim was to clear the pathogen as a priority. So the first half of the treatment sessions were spent strongly clearing by bleeding. And also I did gua sha on the upper neck and also the back. We've also got the support and Sang Chi. While the remaining sessions focus primarily on nourishing and tonifying, with certain points still being bladed in every session, primarily again along 11 spleen 1, Jingwell ghost points. Okay. Excuse me. Okay, so where are we? Okay, so the points chosen, you know, when I'm in doubt in any way, I always go for the EV points. I received a really brilliant piece of advice once that, from a professor of mine, and they said, if you use the EV points in really confusing cases, really beautiful way of creating clarity around the clinical picture by reducing the symptom severity, I guess. So it just kind of makes things a little bit more clearer. So when you've got that craziness of so many symptoms, you've also got COVID on top of it, which puts a whole different fear factor into the whole diagnosis. But I really, even just doing like really working out your case studies is fantastic. Let me just see. Have I missed a page? No, I haven't. Okay. Let's see. So we've also pericardium 6 and spleen 4. So that's great for the digestive organs, also the chest area and the blood and the yin. Pericardium 6 is fantastic to treat arrhythmias. The pericardium itself was really important because that's where it started for him in the tip of the middle finger. So the pericardium channels controls blood flow and the pulse rate and is the heart protector. And we need ample heart chi to maintain that normal rhythm of the heart. We've also got spleen 4 as a lower connecting point of the spleen and can treat cladles and chronic disease. So these are all bleeding Jingwell. Ear apex is fantastic for brain fog, really good. Large intestine 11 because we just love it. Stomach 8 really again is fantastic for clearing the head. Gua sha to open up the way level. Stomach 25. So I came across this really interesting article about stomach 25 and the treatment of AIDS. And it's really good for calming down the storm, especially when you do it with electro. So I have been trialing that and I really love it because a lot of my cases, it almost feels like they're completely bloodborne. Like I'm struggling to see this respiratory connection, even though it is there in a small degree. It can be very complicated. Okay, so treatment plan, we acupuncture twice a week for 12 sessions. We recess after 6, and also I referred to the Jade Screen Project. So this is something really important to me as well. I strongly believe that our patients need to be on herbs as well as having acupuncture. We really need everything to address this. So definitely, you know, open up your referral system and connection between acupuncture and herbalists, and also Qigong and Tai Chi, and really get those connections going and start using each other to really, really benefit our patients because they definitely need it at this time. It's very scary for them. So just to finish up, my patient symptoms fluctuated quite a lot during the first 5 sessions. This has been standard with all of them. So don't worry too much about it. It's the nature of the disease. It will fluctuate. It does change. It changes in character quite a lot. Sleep finally did start to improve after 5 sessions, and then it would slowly improve. And now I think he's up to around 6 hours a night, which I'm delighted about, you know, comparison to what he was on before. So I think he's doing really well. He would prefer 8, but let's go for 6. The patient is slowly gaining weight, so it's nice to see him. He's got a smile back, and the kids are enjoying having daddy back as well, so it's wonderful. So he's really happy, and he's attending clinic every 2 weeks, and I'll probably have him keep coming to see me, I'd say, until maybe February. It's going to take that long. So that's it. But thank you so much, guys. I'm going to just hand you over.
Great, thank you again, Trish. Such a complex picture, and it's really fantastic to see the clarity that you've got around that. Thank you very much.
Thank you so much.
I'm going to hand over to Martin now.
Thanks, Sarah, and thanks for having me, by the way, on this this evening's webinar. It's nice to be able to introduce a bit of herbs, and because that's effectively how I've been treating most of my cases that I've seen with COVID or post-COVID symptoms. So, so I'm an acupuncturist and herbalist, but I've been part of the Jade Screen project for some time, which was set up. Most of you may have heard of the Jade Screen project. It's set up basically to treat frontline workers with herbs for the prevention of COVID. Initially, it was set up to do that, and also the treatment of COVID and the treatment of long COVID or the recovery from COVID. So the idea is that it was set up with funding to enable free consults and free herbs to be given to frontline workers. So it's a really instrumental project for the promotion of what herbal medicine can do for COVID cases. So I've got a case study for you. We're running short of time. There's 20 minutes left before 8:30, and we want to get some questions in. So I'm going to rattle through this. I'm not going to get too much into the nature of the herbs and what herbs can do. There are herbalists among you. So I would refer you on to an excellent webinar, if you haven't seen it, by John Chen on eLotus. And he goes through the treatment of COVID with experience from China, with all the herbal formulas that are used quite successfully. And I think that's probably why they haven't had a greater impact since the initial outbreak in Wuhan in China. So there's 3 hours of herbal gold there. And he only touches on long COVID slightly at the end, because I think it's something that really we're only starting to try and get a handle on. Initially, there was all this talk about how we would treat COVID and how we would treat acute attacks of COVID. Although we've always been told we shouldn't be treating those cases, or we should be careful making claims about treating COVID. So now we're seeing lots of long COVID. We can actually we're not actually treating COVID anymore. We're treating the sequelae of COVID infection. So it's something quite different. So I was involved in the summer with Jade Screen, and this was actually the first case I treated of long COVID, and it's actually one of the most successful cases, so it's a nice one to go through. So we'll rattle through it and see how we go. So it was essentially a nurse. This is just a little bit of background here on the screen about the Jade Screen project. If you haven't seen it, there's a website, and if you'd like to refer your patients for herbal medicine, they're still taking intakes, and there's still about 50 practitioners around the UK, herbalists, who are part of this and who are donating their time for free. And essentially the herbs are then sent to the patient for free as well. So that as long as they're a frontline worker, mainly nurses, doctors, if they're working for the NHS, they get free healthcare from us. So this was a nurse that came through the Jade Screen project and was referred through to me. She was from Swansea, a 27-year-old nurse. Initially, she came in for a consult at the end of July. Well, not came in, I was doing them via Zoom, and I still do all my COVID cases via Zoom because most of them are not local to me. So she was in recovery from a COVID infection that she had in March, and she initially just thought she'd try it. She found out about the Jade Screen project on one of the long COVID Facebook groups. And so she just essentially said, oh, well, why not? Let's give it a go. So this was her history. She basically came down with COVID at the end of March. So it was one of these early cases. And just as a bit of a backstory, I came back from India in March, and 5 days after I got back, I came down with a pretty horrendous flu with aches and pains and neurological signs and digestive issues. So I'm pretty sure I've had COVID. So I can speak with a little bit of experience on what these people go through, even though I didn't make it to a nasty long COVID case. So anyway, she initially had a mild dry cough, and that was it. So for the first week or two, she only had a cough. She didn't have any fever. She didn't have any fatigue. She didn't have any body aches. She didn't have any loss of smell or taste initially. But she was tested for long COVID because of the dry cough. And she was a nurse working in the ER department. And it was confirmed that she did, in fact, test positive for COVID-19. She actually thought initially that if this is all it is, it's a walk in the park. And she was quite pleased she wasn't suffering any more than she was. And then 2 weeks later, she got hit with it like a ton of bricks. She had a drastic deterioration of her condition in a very short space of time, literally only over a day or two, with extreme debilitating fatigue, headaches like you wouldn't believe. She said they were 10 out of 10 headaches. Then her taste and smell was affected. She had a loss of taste and smell. And again, these are all the sort of classic COVID symptoms we now hear about: body aches, chest tightness, the cough continued. She was also getting sharp neurological pains, which a lot of patients do complain of around the body, and debilitating brain fog and confusion as well. So there's this, again, this possibly brain inflammation that we're talking about, and anxiety and insomnia, which she had suffered from insomnia for a long time, but anxiety was something new. So after about a month, she continued coughing and breathing difficulties. The fatigue was off the scale again for another few weeks. The shortness of breath and chest tightness, pains were persisting, foggy headedness. She wasn't getting over it. She was very nearly hospitalized, and her colleagues suggested that she possibly should be hospitalized and even put on a ventilator. It was that bad. But she managed to stay away from that. And a lot of actually her colleagues just said, the typical Western medicine response was, you'll get over it. There's nothing you can do about it. So just go home and rest. She also, interestingly, had all these little mini hemorrhages under the skin. So she was having bleeding. Now that in lingering pathogen school is quite a worrying sign that the pathogens got to the blood level, which is very, very deep. So, she was severely affected by this, and it was quite worrying. Anyway, after 4 months, and this is when I saw her, so she'd been 4 months post onset, she still had persistent extreme fatigue. It hadn't got any better. She still had sharp neurological pains, randomly appearing here, there, and everywhere, like someone was slicing her with a knife. And that's what a lot of patients do report, is they have this, all of a sudden, they just feel like someone's slicing their fingers, these sharp neurological pains. Lots of foggy headedness, poor memory, and affected speech. Again, a common complaint that people can't finish their sentences. Mid-sentence, they'll just forget what they were saying. Very bad anxiety and insomnia. And this was a sort of a situation that was relapsing every week or so. She'd come out of it and get a little bit better, and then she'd relapse back into it. So this classic lingering pathogen type pattern. So we start with, when in the Jade Screen project, it's been quite well set up. We do this MIMOP scale for the main two complaints, and she classed fatigue and insomnia and anxiety as her main two complaints. And she rated both of them on a scale of 0 to 6, 6 being the most, the worst symptoms you can imagine. The insomnia and anxiety was 6 out of 6. And on a bad day, she said the fatigue was 6 out of 6, but she was getting the odd day where it was 2 out of 6. So she was having a few little relapses or remissions from the fatigue. So pattern intake that we all do. She's very bright and friendly, regular build, quite pale pallor and dark around the eyes because of the insomnia. We've gone through the main complaint there about the fatigue and neurological symptoms, etc. The only other interesting thing was she said that it felt like often someone was kicking the bed at night. All of a sudden she'd just wake up with this nerve jerks, which was quite worrying for her. Her sleep, she suffered quite badly with insomnia before, but she was getting sometimes only an hours of sleep a night, sometimes not getting to sleep until about 5 in the morning. So she was absolutely dragging herself around and at her wit's end. So she had resorted to Zopiclone a week before she saw me for consult. Headaches were still there, usually dull frontal headaches, quite mild though now. She developed runny nose and sensitivity to chemicals, something she'd never had before. So there was a hypersensitivity reaction going on. Digestion was fine. I got affected with my digestion for 1 day only, and some people say their digestion really gets hit hard with long COVID, or COVID, sorry. and it can persist into long COVID, but hers were fine. She had been slightly more thirsty and drinking lots more water, so there was thirst. She liked that, so there was heat there. She didn't have a raised temperature when I asked her, but she said that she can feel hot and clammy and then very cold. So she did have this sort of chills and fever, if not a raised temperature. She was sweaty and clammy, as I mentioned. She'd get a shortness of breath and fatigue very easily, mild palpitations, anxiety, that had increased over the last few weeks to the point where she was really worried because she was anxious all the time. Lungs had been steadily improving, so the cough had been improving, so that was a good thing. She did have a UTI at the start of her COVID infection, which she'd been given antibiotics for. Now, I've been doing a bit of research on the long COVID groups, and it's amazing, and I talked to Trish about this and Awais as well, that so many long COVID patients have been taking antibiotics at some point since getting COVID. Now, that's normal if you think that people may have been developing pneumonia or inflammatory problems, that they then think, okay, well, let's treat those. It might be a bacterial infection of the lung or pneumonia. We'll treat that with antibiotics. But it's amazing how many people who have long COVID have been given antibiotics along the way. So whether that's contributing to long COVID, we don't know. She describes herself as unstable, anxious, and depressed. Again, Awais mentioned the mental aspects of long COVID. That was something that was very new for her. And that may well have something to do with the fact that serotonin levels in the gut are really affected by COVID. We can maybe talk about that later. Nothing really to talk about with her menstruation, apart from the fact that the last few periods she had very painful clots, which was again unusual. So this was her tongue, and this is quite an interesting picture that we see a lot with. I'm seeing quite a bit with the COVID cases, and it's similar. The Trish's patient's tongue was very similar in that it's very swollen around the edges and the front. You almost get this sort of ring or rim of swollen tongue around the front, often with a dip in the middle. So it's almost like lung and spleen weakness with the sort of fluid accumulation around the heart and the liver area. And often with these sort of, you can't really see it on there because it was over a Zoom call, but there's lots of little red prickles on the tongue as well. Underneath, you can't really see the bottom of the tongue there, but it was stasis on the sublingual veins that put around 60% on that. So that's quite a sort of typically COVID-y tongue. There was also an interesting left-sided patch on her tongue where there was a slightly thicker coat just in the patch of her left lung. So whether that had anything to do with some of the lung tissue, I don't know. So the diagnosis, this is on a herbal basis because I wasn't treating with acupuncture, I'm just treating with herbs. Like many lingering pathogens, we can consider that mainly as a Xiaoyang disorder, unless there's lots of cold and unless there's lots of weakness in the background and deficiency, where it could be Jue Yin or something like that. So Xiaoyang is quite a typical place for a pathogen to reside in. There's clear blood stasis as well. The pain is a good idea of that, but also under the tongue, the blood stasis is evident. Zhengqi exhaustion, which is very common with the fatigue, the body fluids essentially being affected by this ongoing viral pathogen. Phlegm, misting the mind, and Shen disturbance. And again, that's this confusion that a lot of COVID patients tend to report. So that's what I came up with. And again, the treatment principles shouldn't be any surprise to anyone there, just addressing those things. Okay, so some of you will recognize this. This won't mean much to others, but I've tried to give you an idea there of what each group of herbs do. Zhao Chai Hu Tang is a very famous formula that's mainly used for liver problems, but it can also be used for lingering pathogens and all sorts of gastrointestinal problems, liver problems. And it's one of the great formulas to just harmonize the Xiaoyang, vent out pathogens, and support the spleen and stomach at the same time. So you've got these pairings of organs, Chai Hu and Huang Qin. Huang Qin is one of the main herbs with a component called bicolin, which actually affects the RNA replication of viruses. So it's been shown that that actually stops viruses replicating. So it's probably why it's so useful in this sort of formula. Bangsha Chen Pi, again, some of you will recognize these. That's for clearing damp. Xinjiang is ginger, fresh ginger. Darzao is dates, and Jurgansao is licorice, honey fried. And that supports the spleen in the background. So those little herbs are actually doing the job of protecting the spleen from the cold, heat-clearing herbs above, like Huang Qin. And then you've got a series of herbs which I added here, mainly for this phlegm misting the mind, which is Yuan Zhe, Shi Chang Pu, and Ye Jiao Teng. Yuanzhou and Shevchenko are very famous pairing for clearing misting of the orifices and clearing phlegm and damp. And so they're just to calm the Shen, because she was complaining mostly of anxiety and insomnia as well as the fatigue. So I really wanted to try and get her sleeping better, because she wasn't going to be getting better if she wasn't sleeping. Fu Shen is Poria core, which is a mushroom. Yi Ren is pearl barley, and those two drain damp through the urination. So Bangshan Chen Pi up here, dry damp, and then there's also a couple of herbs to drain damp. So in herbal medicine, we can use different principles to actually treat damp. I think that's one of the strengths of herbal medicine, is that acupuncture really can't get rid of damp other than strengthening the stomach and spleen, or possibly increasing urination. But herbs really do that to good effect. And then the last herb I added here is salvia, and salvia is a very strong blood moving herb, which is danshen, and that's quite a high dose in most formulas, danshen, and that was because blood stasis is clearly an issue. So moving the blood was quite important in this case. So second consult, feels much better. She felt that it was improving. This was only 10 days later, 12 days later. Fatigue was already better, energy slowly returning. She only put it at 1 out of 6 with her fatigue, which after 10 days was quite staggering, because she'd been quite fatigued for a very long time. She was starting to sleep better. She was getting to sleep within 2 hours with no zopiclone, so she rated that as a 3 out of 6. Very few neurological symptoms at all, no alternating hot and cold, and her stool, which she said was normal before, she did say that it had been quite pale and it had returned to normal within about 2 days of taking the herbs. But most of all, the anxiety was 80% better. So she was far less reactive to stress triggers. So after 10 days, that's quite staggering. I mean, even I was quite blown away. And her tongue was quite remarkably different. You look at, there's the before and after there. The before, tongue quite swollen and all this fluid accumulation. And then after 11 days on the herbs, the tongue was relatively normal, almost a bit rigid in some respects. There is a bit of heat around the tip though. So a little bit of heart heat, and the tongue coat was much better. So it was less of this greasy tongue coat. The sublingual veins had improved a little bit as well, so the blood stasis was resolving. Okay, so I was quite happy with that. So I just continued on the same sort of principle really for a second prescription of herbs. But what I did was I added in some spleen and lung tonics a bit more, rather than trying to dry her out too much, because the tongue was actually a little bit dry, if anything. So we're going to be careful with some of these sort of drying herbs that we use to dry damp. So we just changed it a little bit. We kept it essentially the same. And I just added this Baiju and Dangshen. Dangshen is Cordonopsis and Baiju is Atractylodes. And those two are really strong spleen tonics. And the way they do that is they're essentially prebiotics. So they're feeding the good bacteria in the gut. That's the way a lot of herbs work. And then I added Danjuye, which is bamboo shavings, and that is a very good cold medicinal for clearing heat out of the heart, because she had this red tongue tip. And then third consult, which was on the 25th of August, a couple of weeks after that, she just felt amazing. No fatigue at all. After 4 months of debilitating fatigue, she classed that as a 0 out of 6. Sleep was getting better all the time, now at 2 out of 6. She still took a while to get to sleep, but she was sleeping through the night. No neurological symptoms, that was the case before, but she sometimes felt a little bit off the ball. Slight cough had come along. She was expectorating a bit of phlegm. Now, whether that was residual from the lungs or not, we don't know, but it's not a bad thing. Sense of smell had also started picking up, but as when these things return, quite often weird smells start being prominent. So people have reported that quite a bit, that they start smelling things like burnt earth or burnt toast, or strange smells, metallic smells. And the anxiety had completely gone. So she was overjoyed. So really, after 2 batches of herbs, I said, finish the ones you've got, finish them 4 days, and then reduce the dose to half, so it spans them out a little bit more, and then just come off them and see how you feel. Monitor the situation. So that's just a representation of her MIMOP scores, which came from 6 to 0 for the fatigue and 6 to 2 for the insomnia. And if you think about the anxiety on its own, that would be 0 as well. So I won't go through this because we are running short of time. Sorry, I'm waffling on. This is essentially just the treatment progress. Starting to treat the pathogen first and being careful not to tonify too quickly, because if there's damp in the system, you don't want to start throwing lots of tonics. And the more we learn about long COVID and a lot of long COVID patients being possibly triggered into autoimmunity, that's especially true. You don't want to be putting astragalus or huang qi or qi tonics into formulas, if at all, when you're treating long COVID cases. But there are gentle tonics that don't stimulate the immune system too much, like the ones we've used in the formulas here. So patient was back to work. This was a follow-up a few weeks after that. She'd moved house and helped her father move house with no exhaustion at all. Sleep had continued to improve, no fatigue or post-COVID symptoms left. So she was absolutely overjoyed, and she left me a very nice testimonial. So that's just a little bit of a whistle-stop tour of one of the COVID cases. I wish they could all be like that. I have been getting more long COVID cases that have been more challenging. And have involved a lot of deeper pathogens, which are sometimes much harder to deal with. But it was nice to see that she was quite robust, and it was definitely a Shaoyang pathogen, and with the right formula, whether by chance or design, that worked out really, really well for her. So, like I say, there's lots to talk about. The herbalists amongst you will be glad to know that the RCHM is planning a seminar itself to deal with long COVID. We will delve into the herbs and the nature of the herbs and the way the herbs work and go through that. But I just thought this would be nice to add in here for those of you who are herbalists, and for those who aren't, realizing that there is the Jade Screen project, or if they're not suitable for the Jade Screen project, just get in contact with herbalists near you and work with them, because herbal medicine is I think crucial for long COVID recovery. It certainly speeds up the process quite considerably. So thank you. I hope you enjoyed it.
Thank you so much, Martin. That was a phenomenal outcome. It's really so encouraging to see that. It's certainly made me want to study herbs. And Trish, just to see that working the herbs with working with you and your acupuncture treatments, again, a really phenomenal outcome. So thank you very much for that. We're having some questions about how to get in contact with the Jade Screen project. Apparently the names of the practitioners aren't on the website, but
so with the Jade Screen project, the way it's done is all the applications for patient inquiries need to go through the Jade Screen website. So there's a form on the website. So it's very easy to find Jade Screen project on the website, on the web. And there's an application form which then gets either distributed to whoever is closest, or there's also, if there's a practitioner who has a patient in mind, or a practitioner in mind, if they're not a herbalist themselves, they can request to be seen by that herbalist, as long as they're part of the project. But no, there isn't a list of practitioners on the website, but there are 50 herbalists that are putting their hands up to offer their support for this.
Okay, that's fantastic. But if not, then get in contact with a herbalist near you. Yeah,
I mean, absolutely. I mean, the whole lingering pathogen thing is it's a challenge for most of us, I think. I'm trying to work out where the pathogen lies and how to get it out, or whether to treat it in situ. I guess some patients are more, some practitioners are more comfortable doing that than others, but it is quite a challenge. But it clearly falls into this lingering pathogen phase. And there's some interesting stuff that's come out now about the virus components that stay in the GI tract and then possibly get possibly reinfect or continue to cause an effect, this inflammatory mast cell deactivation that's going on with the viral components in the GI tract. And that's probably because the GI tract is full of ACE receptors as well as the lungs. So there's some really fascinating theories coming out now about viruses being dormant in the GI tract. Sometimes about 50% of non-symptomatic COVID cases have been found to have virus dormant in the GI tract. So there's a lot to learn, and there's a lot to try and get our heads around about how best to treat this. But things like Huang Qin, maybe that's why they're so successful in these formulas, is because they are disrupting that gut-based viral fragments that may be sort of left in the gut and causing all sorts of problems.
Yeah, it's fascinating, and the information that's gathering around this, we're learning more and more. Awais, that was a fantastic theoretical background and the Western medicine background. The biggest takeaway for me as an acupuncturist is don't tonify. I have made that mistake myself. I'm just checking the chat box. Is it still, let's just see if there's any questions about the cases. So there was a question about levels of vitamin D. Awais, do you want to say something about that? Because I think...
Yes, yeah. So firstly, thank you for Trish and thank you for Martin. They were amazing presentations. And as you can see, there's lots of different aspects to discuss, and we could come back and discuss them all over again and would still run out of time, such as the nature of the topic. And I'm just very grateful for them to being on the panel and for sharing their knowledge. In relation to the questions which I picked up on the chat, and feel free please to pull me up if I've missed anything. The first question I believe was, that's a good question. How on earth did she get away with not taking beta blockers? Because quite commonly they'll be kind of forced on you, you know, in that circumstance. I think because it's long COVID, because the doctors themselves are reluctant, because they're not sure how someone's going to react in that circumstance. They don't even know why her pulse rate was so high. I think they basically said, she said, I'm not reluctant. I'm reluctant to go on medication. I don't want to go on medication. I've never been on medication for anything in my life. There surely has to be another way, at which point they recommended acupuncture. And just by sheer geographical chance, I was a local acupuncturist and she was too fatigued to go anywhere else. So she said, can I try acupuncture first? And if my pulse rate doesn't come round, I'll discuss beta blockers, was the answer to that question. Because the question was, how on earth was she able to get away with not taking beta blockers? And I think because doctors are a bit confused and they don't know how people are going to react. And having seen the reports from China where long COVID or symptoms have not been so long, they were keen to recommend looking at complementary medicine, as they phrase it. The question regarding vitamin D and C levels, she had, because she was such a weird case, the tachycardia is not uncommon as a presentation of long COVID. Neither is anxiety or the insomnia and many other things we've mentioned. But because hers was so extreme, and because she had no history of coronary heart disease, she had a good medical history. She goes running 3 times a week, plus gym. I think initially they did really extensive blood work. I don't have her blood work with me because it's literally this the file, because they just kept doing everything on a weekly basis to try and get any insight into what was going on. I think her vitamin D and C levels at the time that she presented in hospitals and had the intensive blood work was fine. What it was like in spring, coming out of a long winter, I think might have been a different picture. And, many people have commented that in March and April, probably your vitamin D is the lowest it's going to be all year, having come out of winter. And as we know, people from the ethnic minorities need more vitamin D, more exposure to sunlight, which is another important point for your patients, to remind them that the average is 30, approximately between 30 and 50. But if you're Asian or Afro-Caribbean in your ancestry, it's quite likely that you need a bit more. So her vitamin levels were actually showing her okay at that particular time, if that helps answer the question.
Great, thank you. Got a couple for Martin. Just in case people didn't pick this up, there was a question about why, Martin, you didn't use acupuncture as well, but that was because it was part of the Jade project. So you didn't live near this person, did you?
No, I mean, I didn't know, and I mean, I started when even in lockdown, I was starting to do Zoom consults for herbal medicine. So the Jade Screen project has been primarily Zoom consults, distance consults, because they're not local to me. But I am seeing some patients now who have got long COVID that I've started treating with acupuncture as well as herbs. Yeah, so that's the only reason, really.
And do you use powdered herbs, Martin?
Yes, granules. So I've got a granule dispensary in my clinic, so I make up my own. But for the Jade Screen project, Balance Healthcare have been the ones doing the prescribing. So formulas are made up by Balance Healthcare with their full composition granules, which are very good, and sent directly to the patient.
Fantastic, thank you. Awais, what dose of lion's mane would you recommend, or did you use with your patients?
So normally, actually, I think, something that Martin has kind of talked about is actually, the state of the gut health. And before we, the temptation is to shove everything in there to try and strengthen them up to help resolve the pathogenic factor. And evidently, after a long course of illness, people have the Gucci to digest and metabolize those anything putting into the system, because whatever you put into the system needs to be broken down to a form that it can be absorbed. It needs to be uptaken by the small intestine. The spleen and the kidneys need to provide the ultimate energy for that to happen. So if they're yang deficient, if their intestines are full of damp, my temptation would be to start very gently. So actually, I follow the micronutri recommendation inside the packet. And in her case, again, because she's skeptical, she's never done anything alternative, complementary before, I just said, why don't you just start with one? Start with 1 tablet a day. Let's just make sure it doesn't upset your stomach. And then you, after a week, will go to 2 and then up to 3. And then you can take up to 4 to 6 tablets a day, depending on the dose you're taking. You can take it in a powder, in a smoothie if you prefer. You can take it in a complex with other mushrooms if you prefer. The thing with lion's mane is that in animal studies where rats had nerves severed, where they were given lion's mane mushroom, those nerves regenerated, which is incredible. We're trying to do that with stem cell therapy. We're trying to take a stem cell, inject it into a neuron, and get it to replicate. Well, you don't need to do that if you can use lion's mane, is what some of the research is showing. So post-stroke, post-TIAs, where there's neurological damage, any nerve damage, peripheral neuropathy, tingling, these weird, both Trish and Martin have given you 2 wonderful examples of crazy neurological symptoms where people are twitching in the middle of treatments like the wind. And weird other phlegm obstructions, and as they start to move, they're having weird neurological reactions. Lion's mane seems like a good place in terms of mushroom therapy to work with those type of neurological symptoms, and I would certainly recommend them to any patient with MS, Parkinson's, peripheral neuropathy with diabetes, Raynaud's syndrome. It's relatively cheap and very useful, and just a humble mushroom.
We've had this discussion before, haven't we, as a panel about mushrooms. Am I right in thinking that we shouldn't be using cordyceps for long COVID?
Well, yeah, there's some suggestion that cordyceps may be a little bit too warming for people because let's not. This is another thing that we haven't really discussed, is the fact that there is an inflammatory process still going on for a lot of these long COVID patients, and although it's a damp, cold pathogen to start with, there may not be outward signs of inflammation because there may be poor digestion and cold and fatigue and all these yang shu signs in a way. But inside, you've got an inflammatory process going on with mast cells being degranulated and an inflammatory process carrying on and draining more body fluids. So cordyceps is just a little bit warming, but some formulations do include cordyceps. But there's been a lot more research recently on Ganoderma or reishi, which is one of the main herbs that actually directly targets SARS-CoV-2. Especially if there's any remnants in the gut, that's probably a good thing to do as well. So lion's mane, as Awais was saying, for the neurological symptoms, up to 3 or 4 grams a day. And reishi. Reishi is a great thing for all patients to be taking as a preventative if they can't get hold of Yuping Fengsang or jade windscreen powder or those sorts of preventative immune boosting herbs. And it's something we can all give to our patients, both as a preventative and as a sort of recovery herb, if you like, a great recovery herb on its own, because it balances the immune response. So especially if it's dysregulated in the first place and you've got a pro-inflammatory immune response, mushrooms are great at balancing that down, that T1, TH1, TH2 inflammatory response in the body. Similarly, if long COVID is complicated by autoimmunity, and there is a big tie-in with autoimmunity and the suggestion that actually it could even cause autoimmunity, then it's also good to use for that purpose as well. So it's balancing this dysregulated immune system, and there's going to be some interesting research coming out, I think, about that.
Thank you very much. Thank you. Alan, did you spot any other questions that I may have
Yeah, I
Yes.
mean, there's a fabulous one which has just come in now from Tianjung, and it's a question for Trish. You mentioned that you were doing 6 weeks of acupuncture alongside referring to the Jade Screen project. And he asks, from your point of view, has the combination been better than just acupuncture alone?
Mr. Wang, I'm such a fan of your work. It's been incredible. I'm so sorry, I'm not going to fan gush over you, but I am. Hello. Okay, to answer the question, yes, I at the start, I felt like I wasn't really getting anywhere, and then I really integrated the Jade Screen project into everything that I did. Initially it was like I didn't get them onto herbs maybe until midway through. Now I actually, during the consult, I will say to them they're going on herbs. So if they want to see me for acupuncture, they have to do herbs as well, because I've seen it with people who, like, they're in and out of acupuncture sessions. This one lady in particular, she wasn't sticking to her herbs. I think she done a couple of days and then she said it really upset her tummy. I said, speak to your herbalist. So I'm really pushing her. She was like, no. She came around and then I seen her just last week. She's 6 months in. She got off my treatment couch. I have paper down and the whole couch was soaking in sweat. I mean, so bad, it was running off the table. She had a complete flare up of symptoms. And I just thought, no more herbs and acupuncture. That's my final.
Thank you.
Thank you.
Thanks, Trish. Thanks so much. Well, we have run over time, not surprisingly. So much to unpack there. We've really just kind of skimmed the surface. I hope that's given you some encouragement to treat your long COVID patients and see your local herbalists. So if there are no further questions, I think it just remains to thank you. So a little something there from Alan. The slideshows and recordings will be available on the Let's Talk About Long COVID page of the British Acupuncture Council. So thank you so much, everybody. And we'll say good night.